Understanding Recall Healing Through the Royals, Part 4, Diseases. Speaking from personal experience, the most profound and illuminating part of recall healing are the emotional aspects of diseases. According to recall healing, there are two phases of a disease. There is the conflict active phase and the repair phase. A conflict active phase can involve having cold extremities, poor sleep quality, little to no appetite, overthinking, being scatterbrained, and being overwhelmed. This is when the body is in a sympathetic state or fight or flight. If a person does not find a solution for this conflict, the brain will capture the stress and store it in the part of the brain that the conflict relates to. After this stress is reported in the brain, usually a person experiences relief and they return back to their normal function. Unbeknownst to that person, the core of that emotional conflict is dropped into their subconscious and stored there until a solution is found. When a person finds a solution for that conflict, a person then goes into recovery, repair, or the healing phase. The solution can be practical, like medical intervention, psychological, or transcendental. A person enters the healing phase once the solutions are applied. I speak from experience when I say that the healing, repair, recovery phase can suck. It can be painful as hell, but it is a necessary part of the healing process. Characteristics of the healing phase include being overly tired and needing sleep, confusion, headaches, sweats and fever, vomiting, dizziness, and hunger. There can even be a short period of paralysis. The brain records the stress according to the type of conflict, and it will be applied to that particular body part. Remember, the second part, the illness, only happens when a solution is found. Physical diseases aid in healing as you can figure out the type of conflict or program a person needs to resolve based on their disease. Going forward, I will often refer to diseases as programs, as they are usually unconscious behaviors we are carrying from somewhere within the family tree or experiences. Now let's apply this to Queen Victoria. Queen Victoria suffered from depression, famously carried hemophilia, and later died of a cerebral hemorrhage or stroke. Let's review the programs that created these diseases. Queen Victoria was famously known for her depression and popularizing mourning techniques after the death of her husband, Prince Albert. In the Recall Healing umbrella, there are numerous factors that can cause depression. I will only focus on two postpartum factors: the memory of a dead child in the family tree and your own birth order. It was hypothesized that Queen Victoria suffered from postpartum depression. She was not a fan of pregnancy or infants. There was even a letter from Albert to Victoria advising her to manage her reactions with the children. It is still an assumption on my part that she suffered from postpartum depression. However, if a woman suffers from postpartum, she should review what number child this is for her. If there was a death of a child that lines up with that current birth order, then the mother can be continuing the grief of the mother who mourned the loss of her child. Unfortunately for Queen Victoria, there were deaths of children on both the maternal and paternal side of her family tree. Her maternal grandmother lost her fourth, eighth, and 10th child at a young age. Paternally, the 13th and 14th boys died young, and her aunt, the 15th born, died at a relatively younger age than her siblings, which was the age of 27. This age was kind of long for that time period, but compared to her siblings, she died young. Queen Victoria's own birth order was a factor in her depression too, as she was the number 3 child from her mother's side. According to Recall Healing, the number 3 child is the most prone to depression as they carry the uncompleted grieving process of both parents, stemming from any abortions, miscarriages, stillbirth, or an early death of a previous child. Due to the time she lived in, there were lots of death related to childbirths and children dying young. Hemophilia, the royal disease. In recall healing, there are a few emotional aspects that can create hemophilia. The ones that relate to Victoria include a fear of dying from a stroke, lacking touch from the father, the inability to continue the family lineage, and not being able to be oneself, so the only way to be yourself is to bleed. Queen Victoria died from a stroke at the age of 81. The emotional meaning behind a stroke is that there is a loss of intellectual territory due to not being provided the appropriate intellectual solutions. Another meaning of having a stroke can be that that person was fed up to here. As a parent, Queen Victoria focused on her children's education. She knew she did not receive a satisfactory education to be a competent ruler. She had a typical feminine education for that time, which included learning several languages, including French, German, Italian, and Latin, and scripture. Therefore, it was her mission to give all her children an outstanding education. This program obviously carried into future generations, as many in her family clan, including her son Leopold and other children and grandchildren, carried, suffered, or died due to complications from hemophilia. Another contributing factor for Victoria developing the program hemophilia was lacking the touch of her father. At only 8 months old, her father died of pneumonia. Yet another factor of Queen Victoria developing the program of hemophilia was the pressure that was put onto her even before she was born. During her Project Purpose, which is the first 30 months of life, there was extreme pressure on both parents to continue the British monarchy. This worry was carried into her body and became a program for future generations to carry. Lastly, Victoria grew up in a strict protective household under the Kensington system. The rules were created under the guise of protection, but were essentially developed to make her weak and dependent on her mother and comptroller, John Conroy. Her mother and comptroller, John Conroy, monitored everything she did, controlled who she was allowed to meet and interact with. She even had to sleep in the same room with her mom every night. These rules backfired when Queen Victoria ascended the throne without the need for a regency, as she was 18 years old. With full power, she banished her mom and John Conroy. So, due to the fear of dying from a stroke, the lack of touch from her father, the pressure to continue the lineage, and her strict upbringing, the program of hemophilia was created and carried into the Russian, English, and Spanish bloodlines. To hear more about the emotional aspect of Queen Victoria's diseases, listen to my podcast with recall healing expert Dr. Michelle Lamasa Dawson. Until next time.